Dr. Sharma, for inviting. Thank you, Dr. Sharma, for inviting me. It's a real privilege to be part of your group. And thank you to Neela, who's not on video. She's, I think, joining us from Portugal, who initiated this conversation. And so, hello, everyone. Just a few house rules, so to speak. I would love to see you on video if you can, if it's possible. If you're not moving or traveling, please come on video. And when you're on video, the conversation is completely different. I see Meena joining. Hi, Meena. Good to see you. Good to see you. So there are some faces that I recognize, and these are people who come to my conversations on a regular basis. And there are many of you who I don't know, don't recognize, so welcome. And I'll just explain to you the format of this conversation. And thank you so much, Dr. Sharma, for telling me that, we do have a little bit of extra time, because I thought 1 hour, by the time people settle, by the time we've opened the topic. So thank you for clarifying that, because then we're all preparing ourselves mentally also that there will be time, and I will stay on as long as is necessary, so that, we can have a chat. This whole conversation is not an intellectual one. So you don't have to take notes, because I know that Dr. Sharma records these conversations. They'll be readily available for you to listen to. And that's what I really encourage, that if you are present for these conversations, the moment you start taking notes and trying to get the information, what happens is we activate our left hemisphere. The left hemisphere is our intellect, okay? And the intellect is all about analyzing, processing, fixing. That is the role of the left hemisphere of our brain, okay? But in trying to do that, it has a very limited view of things. And that is not the part that we want to activate for this conversation. For this conversation, we almost we want to bypass our intellect, because our intellect is always trying to fix things, analyze things, process things with a very narrow view. Can you imagine that when we see something as a problem, the part of our mind that sees something as a problem, like, our illness, our pain, everything, that is our left brain. So whenever we see something as a problem, know that it is your left brain that is looking at it in a very limited view, a very narrow view. And it is our left brain that tries to fix it. Now, if the problem has been created from this part of your brain, to engage that part of your brain to fix it is not going to be very helpful. And so what we want to do is we want to actually tone down, pacify, and put this mind at rest. So we're not going to write, we're not going to grasp for information, we're not going to say, oh, what am I going to get? How am I going to use it? Nothing. In fact, this is the complete opposite. The complete opposite of the left is our right brain. The right brain is really the true master. It is what we call our wisdom mind. And this is the wisdom mind that we want to now today activate, because the wisdom mind can see the big picture. The wisdom mind can come up with new perspectives, new ideas, new solutions to look fresh. What we want to do today is to look at something with fresh eyes, and that can only happen if we don't try and engage our left hemisphere. So there's no notes to take. Wonderful. Nothing to remember. Wonderful. Nothing to apply. Yeah. So this is all about being. We're always doing. Yeah. So I think, Dr. Sharma, if I'm right, this is the 12th week of this program, the 12-step program. And I'm sure each week you will have heard that, like, do this work and this will help you in this way. And then you do this and it will help you in this way. So all these 11 weeks were about doing something, right? To help yourself, to help whatever the situation that you find yourself in. It was all about doing something to fix, right? And today it is the complete opposite. The complete opposite is being. When we are not in this doing and fixing, analyze, processing mode, then we rest, we relax. As long as we are in a doing mode, that I have to inspire myself, I have to motivate myself, I have to do my breath work, I have to do my yoga, I have to do my meditation, I have to do my chanting, I have to do my visualization. Can you see? We are always in this hyper-vigilant mode, yeah, saying that, oh, something is wrong with me. We are reinforcing this message all the time. Something is wrong with me. I need to fix it. I need to fix it. I need to fix it. And if I don't do anything to fix it, then it is only going to get worse. Is that right? Don't we think that it is all up to us? So if we are not experiencing well-being, if we are not experiencing health, if we are experiencing pain, if we are experiencing trauma, if we are experiencing illness, disease, anything, we feel there is something I need to do. And if it doesn't get better, we think two things. Either whatever I'm doing is not right. Number one, blame something outside of ourselves. Or second, I'm not doing enough. I'm not doing it right. I'm not meditating. If only I could meditate more. If only I could do more breath work. If only I could do more exercise. If only I could do more of this. But I'm not doing it right, which means, you know what? I'm not going to get better. So all this, we take on this responsibility on us. But there are people here that I see in this forum, someone like Neela, someone like Fatima, someone like Meena. Yeah, these are people I recognize who come on these conversations on a regular basis. And they will testify that the problems that they were going through, right? And they were trying to fix, and they were getting more and more embroiled. After listening to these conversations, after stopping the doing, stopping all the fixing, stopping all the analysis and processing, as their minds calmed down, their natural well-being came to the surface. Their natural healing came to the surface. See, we cannot heal ourselves, but we can contribute to our healing process. And that is what this conversation is about. What if everything that we try to fix ourselves, what if everything is only interfering with the healing process? And this is what we have to understand. Where is it that we are interfering with the healing process? And where is it that we are contributing to our healing process? Once you understand this, the interference stops, you relax, your nervous system relaxes, your body's chemical composition, internal chemical composition changes. Yeah, and automatic healing begins. And this is our goal. So far, everyone okay? Yeah, so far, so good. Yeah. So, a couple of days, these sessions that I do, my conversations, they're not scripted. They are specific to this time, to whoever is on this call or to whoever is listening to this call whenever. They are designed for that. So whatever comes out is just going to come based on what I think would be most beneficial for you in this time that we have together. And what I will do, Dr. Sharma, is that if you think that you want to steer me, to guide me, yeah, in any direction, please do so, because I want this 1 hour or 1.5 hour session to be as useful to everyone as possible. That's my thing. And so, but Dr. Sharma, you know the needs of your community best. And please, at any time, you can ask me questions. You can steer the conversation, guide. I love questions, because if you have a genuine question, then the genuine answer that you need to hear will come through this presence that we are sharing between us. So is that okay, Dr. Sharma? You be the guide? Yeah. And yeah, please steer me. Yeah. So as I said, whenever I have to deliver a presentation, I don't look at notes from an earlier conversation that I did and try and get my material from there. My material content for this conversation usually comes in the week preceding this conversation. So I'll tell you what happened to me 2 days ago. Okay. Now, 2 days ago, I received this. I'm just opening my mobile phone to see the message. Oops. Yeah. I received a text alert on my mobile, and it said, "You have been in close contact with a confirmed case of COVID-19." Right? Now, each one of you, if you get this text alert on your phone, you will all respond very differently. If you are in good health and in good frame of mind, you will just dismiss it. Oh, it's just one of those things, no problem. Okay. Now, if you are in, like, if you're prone to illnesses, if you have high diabetes, or if you're elderly, or if you're whatever, then when you get that alert, you will be slightly anxious. Oh dear, I hope. Yeah. Some of us have a lot of investment. Oh, you know what? I'm going on holiday next week, and it is non-refundable. I've paid a lot of money, made all these arrangements. And now if I get COVID, which means I will not be able to go on holiday, and all these arrangements and all this, our mind will go into this huge anticipation. Am I right? Yeah. And in my case, I'll tell you what happened. In my case, I have a daughter. She's 31 years old, and she's very high risk, in the sense that if she catches COVID, it's a matter of life and death for her. Okay. And in the past 3 years, we have done everything in our thing to keep her safe. But now with everything opening up, yeah, now the risk is even higher, because now there is no place for me to hide, to protect. I have to be out and about. And when I got this alert, knowing that I am a caregiver, I have to care for my daughter, so I can't afford to fall ill. And if I fall ill, if I pass on my illness to her, for her, it's life and death. Okay. So you can imagine what must have gone through in my mind at that time when I received that alert just 2 days ago. Within a minute or so, I started experiencing symptoms in my body. I started shivering. I started experiencing shooting pain. There was something in my throat. All these physical symptoms appeared within a minute in my body. And I said, I've definitely contracted COVID. I have got COVID, and now there is no way out. What do I do? And immediately I went into a panic mode, right? But what happened in a minute or so is that the telephone bell rang. And it was a friend that I hadn't spoken to for a long time. And I started speaking to her and, exchanging a conversation and everything, right? And very nice. We had a lovely conversation. 15, 20 minutes later, we put the phone down. I looked at my watch. Oh, it was time to cook dinner. And I started cooking dinner. And then suddenly a thought popped into my head. And it said, there are no symptoms now in your body. I said, oh, this was all in my mind. Now, I want to explain this. When everyone says it's all in your mind, what does it mean? Right? Does it mean it was just imagination? No, it wasn't imagination. I experienced shivering. I experienced shooting pain. I experienced other symptoms. I experienced feverishness. This was not my imagination. It was in my body. And if you tell me to put my hand on the Bible or the Gita and say, was it physical? Yes, it was physical. Yeah. But here is the thing. Here is the thing. It was physical. It was real. The cause of those symptoms was not physical. Are you with me? Can you now understand? The symptoms can be physical, but the cause of the symptom was not physical. It was in the mind. How do I know it was the mind and not real? How do I know it was the mind? The mind is a very powerful tool. Powerful tool beyond measure. It can bring anything I imagine to life and make it real. Anything I imagine, it has the power to make it real. So this is why it is the greatest deception, greatest illusion of our time. Okay? And the whole thing about the whole thing about human suffering is all suffering is a trick of the mind. I'm not saying all pain is a trick of the mind. The pain is real. Symptoms are real. But the source, if the source is not real, now, if I did not know that this was a deception, this was a trickery, how do I know it was trickery? I know because what happened is when I went on the phone, my mind got diverted. Am I right? My mind got diverted. When my mind got diverted, my symptoms didn't exist. Correct? Yeah. That, and then later on, when I checked, there were no symptoms. Now, if the pain or the symptoms were real and physical, they could not have gone. Are you with me? The fact that my symptoms disappeared, even if it's for 5 minutes, and this has a great bearing on what we're going to discuss about illness, pain. Those of you who are experiencing chronic pain, chronic fatigue, all other symptoms, okay? I want you to start getting curious. Curiosity is the one thing that you need to cultivate to see, is this real or is it not? Okay, that is why we have this beautiful word that Eastern philosophers say. They say Maya. What is Maya? Maya and magic, they come from the same source. Okay, in etymology, the source of the word, the origin of the word Maya and magic, they are the same. Yeah, and it is an illusion, a deception. Your mind can make you think and make anything come completely as if it's real, and you act on it as if it is real. Yeah. Now, this is a very difficult one to take. Yeah. Is my pain imaginary? No, no, pain is not imaginary. Pain is real, but the cause of the pain may not be physical. That is why when we think it is a physical thing and we take painkillers, we take other antidepressants, when we take other medication, etc., for a while we feel better and then it doesn't have any effect. Or we have to keep increasing the dose, or they have other side effects and things like that. But the problem doesn't go away. The doctors nowadays never ever give you a cause of your problems. And if you really push them for a cause, they say it is stress. Okay. And then there are symptoms like anxiety, depression, chronic pain, chronic fatigue. Okay. And when you go to all the doctor will tell you is here. Either they will say, no, there is no physical cause, only stress. Or they will say, well, now you have to take medication and all your life you have to now be on medication. But we know that medication is not the answer to all our problems. Okay, so this talk today is actually an invitation to you to understand that how our mind is affecting our illness. So I'm not saying that all illness is imaginary. There are acute illnesses and there are chronic illnesses. And we have to make a differentiation. Today, if I have flu, today I have COVID, whatever, it is an acute illness. It is an illness right now, which needs medication, needs treatment. But then there are other illnesses, pain, trauma, etc. These are long-standing issues. Okay, they are long-standing issues. Now, when brain researchers look at inside, through fMRIs, through in your brain, what they find is that acute illnesses, they are the activators are in the prefrontal cortex here, in the front part of your brain. Okay, the chronic pain, chronic illnesses, all of those don't exist here. They actually are found in the emotional part of your brain. Now, isn't that interesting that they are found in the emotional part? Yeah, which means that our emotions, our thinking, our mind is somehow interfering, aggravating, sustaining this illness. Are you with me, everybody? Am I making myself clear so far? And even if it's not clear, don't worry at all. You have a recording that you can go back to. So you can hear this over and over again. And also remember, whatever I'm saying, you don't have to understand it to get the benefit of it. Isn't that amazing? You don't even have to apply it or understand it, because when I'm speaking, I'm not even addressing your intellectual mind. I'm addressing your right hemisphere, your wisdom mind, your subconscious. Yeah, that is being right now, it is taking in all the thing. And that is the place where the healing will occur from. So you don't have to worry about your healing, especially for this session. And when I talk about healing, I'm talking about all kinds of healing. It could be healing from a physical problem, physical issue, or it can be healing from an emotional issue. Okay. Now, so far so good. Can I continue with this along the same lines? Yeah. Now, as a child, when I was a very young child, from the age of 5, 6, 7, yeah, I was very ill. I had illness, like I had bone tuberculosis at the age of 7. after my very dear uncle, who was like a father figure for me, passed away. Bone tuberculosis at that time took 1.5 years to be treated because we had to be given injections every alternate day. And it was also highly contagious. So my parents, they actually sent me away to my grandmother, okay, because I had other siblings. And my parents wanted to protect my siblings from contracting tuberculosis. And because it was a 1.5 hour treatment program, she sent me away. But as a child, as a 7-year-old child, the child interpreted this as abandonment. Do you see that? When the child, so it became an emotional issue. And this child was seeking attention. It wanted to get the attention of the parent. Please, 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 I want to be with you. And when a child wants attention, if the child is happy and healthy, the parent just leaves it alone, isn't it? Isn't it true? Yeah. When the child is ill, suddenly the parents say, oh, no, 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 I must do something, and I give it attention, give the child attention. And so this child said, now this is how the mind works. The mind says, you know what? I have been abandoned. And the only way that my parents are even going to look at me is if I fall ill. Now, just as that COVID alert introduced the symptoms in my body, physical symptoms, the same way the mind said, you know what? I can make you ill. And then it'll give you an excuse to go to your parents and get their attention. Now, tell me, the illness is real. Okay, so I would get stomach cramps, I would get fever, I would get colds, coughs, diarrhea. All these symptoms are real. But why are these symptoms manifesting? They are not manifesting because there's something physically wrong with me. So if the whole thing is seeking attention, yeah, can medicine cure this? Can medicines cure it? No. Medicines can suppress the symptoms, but soon, very soon, again, the symptoms will manifest in a different way. So suddenly it's stomach cramps, suddenly it's flu, suddenly it's a brain tumor, suddenly it's headache, anything to seek attention. This is what children do very innocently. This is not manipulation. This is not deviousness or anything like that. It is a very simple strategy by your left hemisphere, by this part of the mind, to create, because it can, this is the power of the mind. Okay? Now, when this child gets attention and everything, then it relaxes. The moment it relaxes, then the body starts healing. Are you with me? So it's all about relaxation and agitation. Relaxation and agitation. Relaxation is the one thing that we have to have at any cost. Any agitation of the mind, yeah, any agitation of the mind, from now on, be very mindful that it is not to be entertained, it is not to be indulged, because the price that you will pay is too high, too high. Yeah, it is said that our body can cope with, yeah, maybe like 3 hours of stress, 3 hours of anxiety over a 72-hour period. No more, no more. If you are constantly anxious, bitter, resentful, angry, yeah, all these kind of things, if you stay in this mode for longer than 3 hours over a 72-hour period, you are then starting to compromise your body. You're starting to compromise your health. You're compromising your nervous system. Yeah, that I'm not making myself anxious. Yes, you're not making yourself anxious. But when an anxious thought comes, when a fearful thought comes, yeah, we have to see it for what it is and then say, you have to be a parent to your own inner child, that it is not necessary. It is not necessary, because the left hemisphere is always this voice of fear. And its job is to tell you of the worst possible scenario, always. If that is its job, and you're only going to, if you're only listening to that part of your brain, then it is doing its job. So at any given time, we have two voices, at least, okay? Two voices. One is the voice of fear, and one is the voice of wisdom. You know, when you go in the car, you have your sat nav, yes, which is going to give you step-by-step direction as to where you have to go, when you will reach, how you have to go, everything step-by-step instruction. And then but if you turn your radio too loud, can you hear the sat nav? No, unless you have that, system where when the sat nav speaks, the radio automatically goes down, then that's different. I'm not talking about that kind of system. I'm talking about a system where both these are happening at the same time. The radio is also on, the sat nav is on, and you've got the radio very loud. Then what will happen? Then you're listening. The radio is like the voice of fear. Okay? And the sat nav is the voice of wisdom. This navigation is always, all the time, constantly available to you. So at any given time, you have the choice. Whenever you feel anxiety, fear, I am now listening to the radio. But while the radio is on, my sat nav is also on. Let me listen to my sat nav instead. My wisdom, my sat nav is always there to help me, guide me, make the right choices, make the right decisions, always there. But if I'm going to listen to the voice of fear, it only knows fear. Are you with me? So moment by moment, we have a choice. Which voice are we going to listen to? So people say, well, of course we have to be anxious, because today if you tell me that you don't have to be anxious, it means that I'm not responsible, doesn't it? Many people say to me, of course, anxiety is good. You have to be anxious. Only then will you do something. So let's analyze. Let's understand that.
And then you told me 40.
Sorry. Thank you. So my daughter, let's say, I mentioned to you that, she is a very, very high risk young adult. Okay. Now, there are many times when we have a medical crisis. Now, when we have to take her to hospital, she can be there for days, weeks, months sometimes. Okay. And as a parent, you would automatically think that if my child is so unwell, I need to be anxious. My anxiety, would you agree, is a sign that I am actually doing something? Yes or no? You would say it is, of course, it's natural, it's normal that you have to be anxious. Well, I now know better. I now know that my anxiety will only keep my mind in my fear zone. Are you with me? My anxiety will only keep me in the fear zone and keep feeding and looping this fear over and over again. My anxiety will not allow me to help my daughter. My anxiety will not allow me to make the right decisions. If I now understand this, I have to devalue anxiety. If I tell you that you drop anxiety, yeah, you will not be able to drop it. You will not be able to drop it. Let's say in your hand, if you're holding diamonds, okay, diamonds, yeah, yeah, and I tell you, drop it, diamonds. So, are you crazy? I'm holding diamonds in my hand. I'm on the road. Am I going to drop it? Of course not. As long as I see value there, I'm not going to drop it. If I can't drop anxiety, if I can't drop stress, if I can't drop fear or a negative thought, it means I am somehow seeing it as valuable. Are you understanding that if I have this anxiety, only then, if I have anger, only then I can control the situation. If I show that I'm not happy, only then can I get the doctors to do the right thing. Are you seeing? Are you seeing the psychology? Yeah. So if I see that there is advantage in my anger, in my anxiety, in my stress, in my fear, I can't drop it. But now, if I say to you, you know what you think are diamonds, they are nothing but pieces of glass. So what? Glass? And then what happens? You don't have to drop it. It just drops. Am I right? Yeah. So this is the trick. This is the trick for any negative thought. Any negative thought is coming from the voice of fear. Am I right? Yeah. Now, where there is a negative thought, there is fear. Now, there are two kinds of fear. If I'm walking on the road and a bus comes, yeah, and at that time, there is no thinking. I just go back. Am I right? Yes or no? If you're in the middle of the road and if a bus is coming towards you, do you stop and think that, will I move? Shall I move? No. You act without any thinking. Am I right? No thinking is necessary. Yeah. If you have to think, it is too late already. So know that when you are in any kind of physical danger, then you don't need to worry. Your body will immediately do the right thing at that time. Suppose you put your hand in a socket, electrical socket, and you get a shock. You think, am I going to pull my finger out or not? Or do you just pull our finger out? Yeah. If a piece of dirt or something goes into your eye, if you're walking, do you think that, oh, now I'm going to blink and now I'm going to clear my eye or anything? Or does it all happen? It all happens naturally, doesn't it? Without your doing anything. Yeah. When you cut your finger or cut any part of your body, yeah, you clean it. You put a bandage on and then you leave it, isn't it? Or do you actually take your bandage out every time and say, oh, is it healing? Do I need to do something to heal it? Who is healing you? Are you in charge of your healing? Are you in charge of your healing? That is the first thing. Your body has an innate capacity to heal itself, provided you are not interfering. So let's talk about what is interference. What is interference? Interference is anything that keeps this problem in place. What is that? Fear. Oh my goodness. What if this pain continues? So we have pain. Okay, let's say any of you have pain, chronic pain. I mean, I can only see a few faces. You have something, yeah? So yeah, pain, yeah? So now, Beena, you have pain. Now, while you've been talking to this, listening to this conversation, how is your pain?
Well, sadly, my pain is still there.
Okay, fine. So you're looking, but often what happens is when our mind is diverted, often there is no experience of pain. So pain actually resides in our mind. Pain resides in our mind, okay? And when our mind is diverted, do you know what? At any given time, our brain, our attention can only take in 120 bits of information. Only 120 bits of information. Now, as you're listening to me, that is almost 60 bits of information. Now, which means that if two people are talking at the same time, you can't listen to both people at the same time. That is only the bandwidth. So when I am fully focused on something, yeah, I can't experience pain. This is a fact. Yeah, this is a fact that so pain resides in the mind. Now, there can be physical pain, but then there is another part, which is what we say suffering. Pain and suffering are two different things. I can have pain, but I may not suffer the pain. And I can have pain and I can be suffering. Yeah, what is the difference? Every time I resist the pain, every time I think I don't want the pain, I want to avoid the pain, it is inconvenient, I want to cope with the pain, I want to manage the pain, I want to control the pain, that becomes solid. Until then, it was fluid. It was so fluid that if I get distracted, then I forget that I have pain. Yeah. So yes, it comes back because again, I become focused again on the pain and I can experience it. But when my attention is diverted, when something is really, that is why, there are people who have problem walking or something like that. Okay. And they say, no, I can't walk. I can't get up. I need help. I need this, that, and the other. Now, what if the fire alarm goes on and the house is on fire? Have you seen in these movies that these people who say, I can't do this and I can't do that, they just get up and then they go out and walk. Am I right? How did they do that? Yeah. How did they do that? Or sometimes, we've heard of these stories where a mother, okay, now she sees that her child is trapped underneath something very heavy. Okay. Her child is, and suddenly she will lift that heavy thing and protect her child. Okay. Afterwards, she tries to lift that same thing. She can never lift it. Why? Where did that strength come from? Yeah. This is the capacity of our mind. This is the power of your mind. So you can either use this power to heal yourself, or you can but innocently misuse, okay? Not misuse. No one would misuse this power knowingly. We do it innocently. You can innocently misuse this power and cause yourself more distress and suffering. Okay? So one thing is pain and suffering, you have to put them aside because people, even the most enlightened masters or anyone can have illness. They can have cancer, they can have anything, but they don't have to suffer their cancer. Today, I speak to many cancer patients, okay? And they are so afraid. I'm going to have pain. They don't have pain right now. But the fear, I'm going to have pain. I'm not going to be able to cope with pain. This is what's going to happen to me. All this fear, what is that? Anticipation of something that is not happening now. Isn't it true? Isn't it true? So they are not suffering their present condition. What are they suffering? They are suffering anticipated pain. Now, this is not just true of physical pain. It is true of people. We think that, if you have lots of money, then I will have no problems. Yeah, many people have this notion that, if only I had this, I would have no problems. If I had lots of money. But I have come across many, many wealthy people who are living in terror every day. What if I don't have enough money tomorrow? Now, they have the money today, but they are still insecure about what if I don't have tomorrow? How will I cope? Because once you get used to a very lavish lifestyle, it's very difficult to imagine a time when I won't have that lifestyle. So can you see that everyone, the human condition is such that unless and until you understand your mind and the working of the mind, you will suffer, whether you have something or you don't have something. So people who don't have money think that, I'm suffering because I don't have money. People who have money are suffering because what if I don't have money? People who don't have health, they are suffering because, if only I was well. People who are healthy are suffering. What if tomorrow I fall ill? What will happen to me? Are you seeing? So all of us, what are we? Whatever our situation, if we don't understand this aspect of our mind, then we will suffer. So what is the answer? We've got a few minutes and then I'll open it up to two questions, okay? Because I didn't realize. Did you realize that we've been having this conversation for 50 minutes? Did you realize that? Yeah. But if I today now tell you that you have to sit for 50 minutes in meditation, close eyes, yeah, and just look within, what will happen? My goodness, it will seem like torture and torment, isn't it? But right now, you were happily listening to this thing. Nothing exists. Only you and I exist. Yeah, 50 minutes gone. Do you see the power of your mind? Yeah. Now, I had this young lady. Yeah, I was addressing a group of school students, 17-year-olds or whatever, right? And this, so there were about 15 students or something like that. And then towards the end, when I opened up to questions, this young lady, she says to me, I have a problem. I have ADHD. I said, yeah, ADHD means attention deficit disorder, right? Which means that, I can't do my studies properly. I can't focus on my studies. I do nothing, whatever, all these things she started saying. Okay. And I said, we've been having this conversation for almost 45 minutes, I said to her. Could you focus on that? She said, yeah, I could. I said, well, then you don't have ADHD. Do you see that? Yeah. So when we find something of interest, when something is of interest to us, when we have enthusiasm, passion for something, all sense of time disappears. Yeah, because we are so engrossed. Now, at that time, our attention is not on ourselves. Am I right? Am I right? Yeah. Now, if you want well-being, one of the first tips that I would give you is don't be so self-absorbed. Don't have so much focus on trying to fix yourself. Yeah. The less you have you in your mind, the quicker the healing process. Because you can only have you in my mind, only the left hemisphere knows of you as you. The right hemisphere does not have any concept of you as a separate identity. It is the left hemisphere of my brain that tells me, you know what? This jacket, Kajal, is not you. You and this jacket are separate. You and these pair of glasses, they are separate. The right hemisphere does not know that, right? So every time we are focused on ourselves, and too much of that self-absorption of, I have to fix myself. I have to make myself better. I have to do this to myself. Now I have to do meditation. Now I have to do running. Now I have to do chanting. All this is self-absorption. And the more you pay attention to that, the less the healing, because you're in your left brain. Healing happens through the right brain. That is why we say sleep is so, so important, because in your sleep, your left hemisphere, your sense of identity, your sense of you as a person, all that dissolves. That is why sleep is the right best time for healing. That is why even brain waves, we say theta healing. What is theta healing? Our normal waking consciousness is all beta level. All beta level brain wave. Okay. Then as we are falling asleep, we go into alpha level. Unless you go into alpha level, you can't go off to sleep. That means you have to leave all this worry and everything aside. Only then can you go into alpha level. Only then can you go into sleep. And then you go drop deeper into theta level. When you go into theta level, a part of your mind is conscious, but the intellectual part, which is always trying to interfere, which is trying to fix, process, analyze. I have to do this. The doing. That goes to sleep. And that is why we have what is known as theta healing, because, and all these healing are all in you right now. You don't have to take yourself to a healer. The best healer is in you. But what we do innocently is we say, I am broken. I am unwell. I take myself to this healer, to this doctor, to this therapist, to this, fix me. So the responsibility of my healing, I give to somebody else. Are you seeing? I'm not saying don't go to a doctor. I also go to a doctor. I take my daughter to a doctor, go to a hospital, everything I do. But I'm still taking full responsibility of my well-being, because a doctor can treat. Any therapist can treat, but he cannot cure without your contribution in the healing process. Are you with me? Yeah. You have to be part of that healing process. That means you have to take charge. And then from that, and that can't come from fear. Fear will say, oh, I'm no good. Someone please fix me. Someone make me better. Someone give me this. That is the voice of fear. But the voice of wisdom says, no, I can heal you. Yes, you will need a helping hand. Now, then it'll guide you. Go to this person, go to this doctor, listen to this person. It will guide you. It will take you to the right place at the right time. Listen to that navigation system, which is always present. And when you start tuning into that, you will worry less. You will relax. You will ease. Okay? And then your healing can start. Right? Now, I've spoken enough. I would love if Neela, who is on camera, to just share her story of how these conversations have helped, and even Meena, if she would like to. Both these people, they have very nice stories to tell you. And